Good afternoon. This is Yogesh from Tirupati HIMS software. Currently, in today's present tutorial, we are going to present you the daycare module in which how you can maintain daycare OPD services for the particular patient where you can maintain procedure and performing billing and you can make them discharge patient once the OPD services have you delivered. So let's log in with the software. Okay, so these are the login credential will be allocated by your administrator in the respective module. So you can capable to log in and go to the respective module assigned to you. Okay, now as you see there we have assigned four modules which is daycare, sorry, dashboard, registration, daycare, and finance report. Okay. In the dashboard module, you can able to maintain how many patients are there in the daycare services, so you can observe them to perform their day-to-day services. So here you can able to see daycare services. If you click on the certain this module, you will be landing to respective module where you can see the list of patients which are available in the daycare services. If you select any particular patient, then you can capable to see the whatever previous services has been delivered to the patient with the date, name, and transaction services and the admit patient detail. If you are wanted to search any particular patient with the name, UHID, mobile number, so you can get it with the name either giving the input of the respective entities. So let's make a new patient entry. We go to registration window where we can maintain patients entry and we can able to daycare services to the particular patient. Okay, and these are the panel category, either patient cash card, UPI, like this. And you can select the daycare services and mention patient demographic detail like uh, Sita Devi Sharma, for example, and having patient record like this way, and wife of like Ram Kumar Sharma, and patient address like Sirpur. Okay. And here we can give the respective daycare ward that will be reflect in the patient. So where we can see how many beds are available. If any particular patient is occupied with the respective bed, the name and bed number will be occupied will be disabled. Only enable beds you can allocate to the certain patient. Why? What is the reason? Like accidental case, why the patient have come to hospital, you can describe here and in the diagnosis and detail what you are going to perform, so you can describe the primary surgery or the minor surgery like that. Okay, so we can describe information of patient demographic detail, attendance, and here we can mention the admission fees, charges of the patient, hospital services or like that. So let me make some services, any advance payment or particular services we can select it. And 1 second, admission fees or IP admission charges along with the patient's minor dressing charges. Okay, and this way you can make the payment cash card, UPI, and the registration will be performed under the daycare facilities. And at this time, if you miss any service, the system will make you alert which department you need to be select, like patient mobile number and some information has been mentioned, so we can fit properly. And here right side you can see the patient attendant detail also you can mention if needed. So in the case of patient is critical or unconscious, in that case you can contact to their respective family coordinate. And just a 7 pin, the patient's daycare services will be registered and patient entry will be done in the daycare window. Now let's see in the daycare module. In this window, you can see how many patients are registered in daycare window with the detail of patient name, his age, gender, and certain detail under which doctor is caring of the patient. And once we select the patient, we can see whatever service has been given to the patient. As well as if we want to see here, we want to apply any services to patient. So nurse can capable to mention like staging charges or any oxygen services or plaster charges, so we can perform like Riley tube. So this facilities you can add to the particular patient billing services and generate the service in the patient account. Okay. Once you want to patients generate this bill as well as the billing services will be added to patient credit facility. Okay. And if you want to see give him patient ID card or NABH invoice or detail invoice, so you can generate the respective invoice detailing with the containing of services provided to the patient. So these are the service which has been given. A daycare service bill, performa bill will be generated. These are the primary information about this daycare module. And if you want to know more about this module and functionality of the software, so you can discuss in detail the next video. Okay, as well as under the same video, you can go through the user collection reports of how much collection we have received from the daycare window. So we go in daycare window and go to how much collection reports have been generated. So you can see the itemized collection revenue will be visible. It can be exportable user-wise, and all details is coming in the certain patient account and one-to-one entry performed by user ID. Okay, so this is a small introduction of the daycare module. Thank you. Have a good day. Right.